Hi, I'm Nicole Barrios, and welcome to another episode of Ask an Acupuncturist. So in this episode, I'm going to be answering the question, can you get acupuncture when you're pregnant? And the answer to that is an emphatic yes. Yes, yes, yes. I highly encourage pregnant mamas to get acupuncture because it's so good. But yes, it's safe and it's effective, and all pregnant women can receive it. So when you get acupuncture while you're pregnant, there are a handful of acupuncture points that are contraindicated during pregnancy. And then obviously we're not going to be doing acupuncture points like on your belly, like as your baby is growing. And so that's all fine. So there's certain things that we have to avoid during pregnancy, but ultimately, yes, you can get acupuncture during pregnancy. So your treatments might look different depending on what trimester you're in. So typically in the first trimester, we take it a little bit like a more gentle approach with the pregnant mamas. And we treat a lot of morning sickness, or I treat a lot of morning sickness during the first trimester. And also we do a lot of treatments to kind of like, we call it raising and holding. So this is basically like making sure that everything stays up. Like we want to prevent miscarriage. So we help to like stabilize the pregnancy and keep the baby snug and where it should be. And then as things progress, as mamas get into the second and third trimesters, the treatment can change a little bit. You know, we start to treat more like sciatica or the pregnancy-induced carpal tunnel, or just whatever else might be coming up during pregnancy. Like we treat that as the pregnancy progresses while avoiding those contraindicated points. And then towards the end of the third trimester, when you're about 38 weeks, and with the approval of your doctor or midwife, we can start to induce labor. And so labor induction for pregnancy with acupuncture is pretty cool. It's not a guaranteed thing, just like any procedure. When it comes to getting a baby into the world, babies arrive whenever they want to. But what acupuncture can do is it can, towards the end, the 38-week mark, when everything's looking good and it's time to start stimulating labor, it can kind of help the uterus start contracting a little bit. It relaxes the body. It gets the mom in a state of just relaxation and feeling good, so that she feels more open and her body is more like ready to start going into labor. And so everybody is different. Sometimes labor induction happens really quickly and others it doesn't. It just depends on the patient and the baby, because babies have their own timeline and they come whenever they want to. But yes, pregnant women can absolutely get acupuncture, and I definitely recommend it because it just makes the experience a lot more easygoing and smooth sailing, and can also make the labor and delivery itself just more easygoing and smooth sailing. And then it can also be used postpartum when you're in the recovery phase to just help you kind of build back up. And then you can also use it on your baby too. So yes, I highly recommend acupuncture during pregnancy. So I hope that answers the question. Feel free to comment below, and I will catch you guys in the next video.